So these changes coming in Quebec as of March the 7th for both elementary and high school students. Quebec teachers were not consulted, they say, in all of this, and they don't like it. What do you think?
Yeah, I think it's tricky for teachers, right? Because they don't have any say, and all of a sudden, likely a whole bunch of parents will choose to remove the mask for kids, and then they'll be in that environment. And I think masks are going to be a tricky one. You know, slowly we are removing restrictions, we're removing mandates. Masks are, to me, one of the easy things to do, right? They're not infringing on someone's autonomy. They're not keeping businesses shut. They're not having the mental health impacts of lockdowns. And yet they're very effective. So as we remove masks, I think we're going to want to do that in the lowest risk settings first. And schools, to me, are a high risk setting. You know, you have an indoor environment. The teachers are talking about poor ventilation, which remains a concern. You have a bunch of kids who are not vaccinated. None of the kids are triple vaccinated, which is what you kind of need now for protection with Omicron. So that's a high risk environment where you're taking off the mask. The counter argument people make is that kids are not very susceptible to severe disease. But the problem is that kids are part of the community, and they can spread that virus to their parents, their grandparents, and of course the teachers. So that still represents a risk. And I think when this happens, eventually, I think it'll be helpful to look at modeling studies, because we know that when you take the masks off in any setting, including in schools, you are going to drive infections. And we probably want to do those modeling studies just to be confident that the number of infections you're driving can be absorbed by our health system. We'll be able to take care of those people. And the other thing you don't want to do is you don't want to paradoxically worsen the school experience. And you could do that if you do this too early, and there's enough virus in the community that by unmasking in schools, you actually cause outbreaks. And then you have actually, kids who are unmasked, but then you have an outbreak, so they're home either isolating or quarantining. And I'll tell you that I'd much rather my 6-year-old go to school with a mask than stay home because she's had an exposure or she's sick. So yes, we have to make sure we're at the right point in the pandemic in terms of community spread to prevent that. I think right now is a little too early based on what the modeling studies are telling us.
That's interesting. I mean, in Quebec, the officials were saying they're looking at schools first of all, and then they're going to move slowly, see how it goes in the schools before they look at the mask mandates in places like public transit, for example. But in making the decision, they said they were looking at very specific data, Dr. Gupta. Number one, the vaccination rate in the province, also looking at the fact that millions of Quebecers got Omicron, so they had that natural immunity as well, and the hospitalization rate was satisfactory to their eyes. Are those the kinds of things that health authorities should be looking at as they make those decisions? Because it's not just Quebec looking at masking right now.
Yeah, for sure. Health system capacity is a big one because, as I mentioned, anytime you reduce one of these mandates, one of these restrictions, you are going to see more cases. You have to make sure your health system is ready for those cases. Of course, how well protected the population is in terms of uptake of vaccines, but also natural infection. And then, just the environment you're doing in. When we talked about, how high risk is that environment for spread. And we don't have great data on what, community transmission and, burden of disease is like in the community because we don't have that testing right now. So the best sort of corollary to that is the pressure on our health systems right now.